The ER was loud with routine. Monitors chiming, nurses moving fast, residents talking over each other like they owned the room. The new nurse stood at the edge of it all, quiet, carrying supplies no one asked her to carry. Someone laughed when she double-checked a medication label. Someone called her rookie like it was her name. She did not react. She just kept working. Then the overhead speaker crackled. Trauma team stand by, incoming military medevac. The room shifted. The charge nurse looked up. The attending stepped out of the charting room. A helicopter was already beating the air outside, so close the windows trembled. And then the next line came through, calm, controlled, not hospital staff. This is Navy flight crew. We are landing now. We need Nurse Ellis. Repeat, we need her by name. The ER went silent, because nobody in that hospital knew who Nurse Ellis really was, and in the next few minutes, they were going to find out they had been wrong about her the entire time. Mercy Point Emergency Department did not get quiet at night. It only changed its shape. The waiting room lights stayed harsh. The monitors never stopped chiming. The air smelled like antiseptic, old coffee, and the faint metallic edge that came from blood you did not see until it was on the floor. At 18:52, the staff entrance badge reader blinked green and Nurse Evelyn Ellis stepped inside. She was early. She always was. No one greeted her. The night charge nurse, Marla, was already at the central station with a clipboard, running the board like a battlefield map. Two senior nurses leaned against the counter, laughing at something on a resident's phone. A janitor pushed a mop bucket past the trauma doors, eyes down, practiced at moving through people who did not look back. Ellis crossed the floor without hurry. Navy blue scrubs, hair pinned tight. No jewelry, no perfume. Her ID badge was new and still too white at the edges, like it had not learned the shape of a working hospital yet. She stopped at her locker, opened it, and laid out her tools with a kind of quiet precision that looked almost ritual. Trauma shears clipped to her pocket, pen light checked, tape torn and folded. A pair of gloves tucked where her fingers could find them without thinking. Behind her, a senior nurse's voice carried easily. "New girls early again," the nurse said, not bothering to lower her tone. "Trying to impress somebody," a second voice, male, young, confident, answered, a resident. "Let her. It'll wear off." Ellis closed her locker and turned, expression flat, as if she had not heard a word. She walked to the central station and waited until Marla looked up. Marla's eyes flicked over her badge. "Ellis, you're the transfer." "Yes, you've got Bay 3 and Bay 4, low acuity, fast track overflow, keep it moving tonight, we're short." Ellis nodded once. "Understood." Marla handed her a stack of charts without asking if she had questions. That was the tone here. You either kept up or you became somebody else's problem. Ellis moved toward Bay 3. The curtain was half drawn. A man in his late 50s sat on the gurney holding his left forearm, face tight with pain and embarrassment. His wife stood beside him, clutching a purse like it was a flotation device. "Mr. Landry?" Ellis asked. He looked up. "Yeah, I'm Nurse Ellis." "Tell me what happened." "I slipped on the steps," he said quickly. "Just went down hard." Ellis did not react to the speed of the answer. She stepped closer, voice even. "Did you hit your head?" "No." "Any blood thinners?" "No." She took his wrist gently, fingers on his pulse. She did not squeeze like she was trying to prove something. She simply measured. Watched his breathing, noted the slight sweat at his hairline that did not match the room temperature. She examined the forearm. Swelling, deformity, likely a fracture. But the skin was pale around the injury in a way that made her eyes pause for a fraction of a second. She looked at his fingertips. "Can you wiggle your fingers for me?" he tried. The movement was small and delayed. Ellis turned her head toward the monitor at the wall, heart rate 108. A pain response, maybe, or something else. She did not announce her thinking, she just worked. "I'm going to check circulation," she said. "You may feel pressure." She palpated along the forearm, careful at the swelling, then higher near the elbow. She checked capillary refill, too slow. She leaned out and caught the passing tech. "I need a set of vitals repeated and an ice pack, please." The tech hesitated. "He already has vitals." "Repeat them," Ellis said, not louder, not sharper. "Just final." The tech moved. A resident pulled the curtain open without warning, tablet in hand. He was wearing the casual confidence of someone who had not been corrected enough times yet. "What have we got?" Ellis gave him the facts cleanly. Fall on stairs, deformity left forearm, pain 8 of 10, delayed cap refill, reduced finger movement. He barely glanced at the arm. X-ray. Give him something for pain. Ibuprofen is fine. Ellis did not argue. She turned slightly so the resident had to look at her if he wanted to keep speaking over her. His hand is cool and pale. I want to rule out compartment syndrome or vascular compromise. The resident exhaled through his nose as if she had said something inconvenient. He fell on stairs. It's a fracture. Don't overthink it. Ellis held his gaze. If it's vascular, ibuprofen doesn't matter. He needs imaging now and ortho alerted early. The resident stared at her for one extra second, then gave a small, dismissive nod like he was humoring a child. Fine, page ortho if you want. Just don't slow me down. He left the curtain open behind him. Mr. Landry's wife looked between Ellis and the departing resident, unsure which one was allowed to be right. Ellis turned back to the patient, voice steady, as if nothing had happened. I'm going to take care of you, she said. You did the right thing coming in. She moved efficiently, orders placed, a call made, a splint prepared without drama, not because she needed credit and not because she needed approval. Because that was the work. At the nurse's station, laughter broke again, someone replaying a clip, someone calling somebody else rookie like it was harmless. Ellis did not look up. But she did mark the time on her notepad, small and precise. And as she wrote, her eyes briefly tracked the trauma doors, an unconscious habit like she was measuring distance, exits, angles. Like she had learned long ago that a room could change in a single second. And when it did, you either noticed first or you did not notice again. By 20:10, the board was already wrong. Not because the numbers were incorrect, wait times, bed counts, triage levels, but because the ER was running on a kind of optimism that only existed when people were too busy to admit what was coming. Mercy Point could absorb anything until it could not. Ellis stood at the central station, scanning the tracking screen once, then turning away. She did not stare at it like a puzzle. She treated it like weather, something you respected, something you did not negotiate with. A nurse called across the counter. Ellis, fast track needs you. Bay 4's buzzing. Ellis nodded, grabbed a fresh blood pressure cuff and walked. Bay 4 was separated by a curtain and a thin strip of space that never felt private. A young man sat on the gurney, early 30s, clean clothes, clean shoes, no smell of alcohol. One hand held his ribs. The other rested on his thigh like he was trying to keep still. His face was calm in a way that did not match pain. Ellis stepped in and introduced herself. Nurse Ellis, what's your name? He hesitated half a beat. John. Last name? Another half beat. Miller. Ellis did not write it down immediately. She watched his eyes, not for guilt, for orientation, for whether he tracked movement outside the curtain. What brings you in tonight, John? Fell, he said too quickly, off a ladder at work. Ellis looked at his hands, no dust, no paint, no scraped knuckles. She looked at his boots. Too clean for a construction site. His breathing was controlled, shallow, like he was protecting something under his ribs. Where were you working? She asked. He gave a street name without looking up, a confident answer delivered too smoothly. Ellis pulled the curtain a few inches wider and checked the hallway without turning her head much. Habit, small. Unnoticed, she stepped closer and lifted his shirt slightly, only enough to assess. There was bruising at the left lower ribs, but the pattern was narrow and angled, not broad like a ladder fall. 3 parallel marks, tight spacing. Her eyes narrowed a fraction. Any loss of consciousness? No. Any nausea, dizziness? No. Ellis took his vitals herself. She did not delegate it. Blood pressure slightly low, heart rate elevated but not frantic. His skin was cool beneath her fingers. He watched her hands while she worked, not her face, her hands. Ellis felt the quiet shift in her chest, the moment her mind stopped being hospital only. The moment it began building a second picture alongside the first. On a scale of 1 to 10, she asked, how is the pain when you breathe in? 7. Any pain in your abdomen? He shook his head. Ellis palpated gently anyway. When her fingers reached the upper left quadrant, his body reacted before his voice did. An involuntary tightening, a faint flinch he tried to hide. Ellis kept her tone neutral. I'm going to order a chest x-ray and some blood work. He nodded too fast. Sure. And I'm going to put you on a monitor. That's not necessary. Ellis looked at him, calm, direct. It is. He held her gaze for 1 second longer than most patients did. Then he looked away, jaw tight. Ellis stepped out to the nurse's station and started orders under his chart. Marla glanced over. Fast Track doesn't get monitors, Marla said. Ellis did not argue, did not plead. He needs one. Marla's expression tightened. Based on what? Ellis kept her voice low. His story does not match his injury pattern. His vitals are compensating. I want eyes on him. Marla stared like Ellis had made this personal. You're new, Marla said carefully like she was warning her. Don't go hunting ghosts, we have real patients. Ellis nodded once. I understand. Marla returned to the board. The conversation was over. Ellis placed the monitor order anyway, but she did it quietly. No announcement, no challenge. She attached it as if it had always been the plan. A tech rolled the machine in without asking questions, because machines did not care about hierarchy. While the monitor booted, Ellis moved through the supply room and checked the trauma cart seals without touching them. She looked at the airway drawer. She looked at the blood fridge temperature log. She verified the location of the rapid infuser tubing, not because she expected to use it, because she refused to be surprised. When she returned to Bay 4, John Miller was staring at the curtain again. Ellis adjusted the leads and watched the waveform settle. She asked soft questions while her eyes did harder work. Any medical history? No. Any medications? No. Allergies? No. Everything about him was clean, too clean, like he had rehearsed being simple. Ellis's phone vibrated with a message from radiology. X-ray backlog, 30 minutes. She did not show irritation. She simply nodded as if she had expected the delay. Then she noticed something else, something small, easy to miss if you were thinking only in terms of accidents. A tiny puncture in his shirt near the bruising, not torn, not scraped. A neat round hole. Ellis leaned closer, pretending to adjust the electrode. The hole was burned at the edge, a contact mark, heat, not friction. Her throat tightened slightly, but her face stayed still. She stepped back and met his eyes. Did anyone come with you? No. Anyone know you're here? He held her gaze. No, Ellis nodded as if that was normal. Inside, she made a decision. She did not know who he was, but she knew what he was not. He was not safe to leave unobserved. She walked out and went to the clerk at the desk. If anyone asks for Bay 4, you tell me before you let them back. The clerk blinked. Why? Ellis's voice stayed soft. Just do it. Then she went to Marla again, more careful this time. Move him closer to the nurse's station, Ellis said. If a bed opens. Marla gave a short laugh. Now you want a trauma bay for fast-track bruised ribs? Ellis did not smile. Yes, Marla stared at her. The senior nurses were listening now. The resident from earlier walked by and glanced over, amused. Marla lowered her voice. Ellis, you are not going to reorganize my department on a feeling. Ellis nodded once. Then let me be wrong. But let him be seen. Marla held her stare, measuring the cost of indulging the new nurse against the cost of ignoring her. Finally, Marla exhaled. Fine. When Bay 3 clears, you move him. Ellis said nothing. No thank you, no victory. She went back to Bay 4 and checked the man's pupils, his breathing, his skin temperature again. Quiet competence. No drama. And as she worked the glass in the outer corridor, windows trembled faintly, just once like distant thunder. Nobody else reacted. Ellis did. She paused for half a second, listening, eyes angled toward the ambulance bay. Then she resumed her task as if nothing had happened, because the only way to stay invisible was to never look afraid. Not even when the air outside started to change. The tremor came again, stronger this time, shivering the glass along the ambulance bay corridor as if the building itself had taken a breath. Ellis did not move faster. She did not look around. She only reached up and tightened the blood pressure cuff on John Miller with the same calm hands, then looked at the monitor as if her whole world still fit inside that waveform. Outside the curtain, footsteps accelerated. A stretcher wheel squealed. Someone shouted for respiratory. Then the overhead speaker popped with static. Trauma team, stand by, incoming medevac. Repeat, incoming medevac. The effect was immediate. The ER's casual noise thinned out, replaced by a focused, sharp movement. Chairs scraped. Curtains snapped open. Marla's posture changed at the desk, shoulders squaring as she grabbed the trauma binder and started calling assignments without looking up. Bay 1 gets cleared. Now, Sam, you're on airway. Jenna, you're on lines. Pharmacy, I want the cooler ready. A resident in a white coat jogged toward the trauma bays, still talking as if he could control the situation by naming it. Probably a car wreck. We've been getting them all week. Ellis stepped out of Bay 4 and walked straight to Marla. Which bay? She asked. Marla's eyes flicked to her, irritation ready. Why? Ellis held her gaze neutral. So I can stay out of the way. Marla made a short, humorless sound. Bay 1, and you're not going anywhere near it. You keep fast track moving. Ellis nodded once and turned back toward Bay 4. Behind her, the tremor became a steady vibration, the unmistakable rotor wash pounding the air, not a distant helicopter. Close, landing close. The ambulance bay doors slid open with a pneumatic hiss. Cold air rushed in. With it came a sound that swallowed everything else, blades cutting the night heavy and controlled. Even the waiting room fell quiet for a moment, as if the building knew better than to compete. A security guard appeared at the doors, suddenly alert. He spoke into his radio. We've got a bird landing on the pad. Who approved this? No one answered him. The doors burst open again and two figures moved in. Flight crew, helmets clipped to their vests, navy patches on their shoulders. They were not running. They were moving with urgency and precision, like the line between speed and chaos was something they had learned not to cross. Between them, a Navy corpsman pushed a gurney. The patient was strapped down, intubated, chest rising mechanically with each squeeze of the bag. A blanket covered most of him, but not the blood. It had seeped through in dark patches across the abdomen and shoulder, and the bandage on the left side of his neck was already soaked through, as if it could not hold what was trying to leave. The corpsman's eyes scanned the ER. He did not ask where trauma was, he already knew. He saw Marla and moved straight toward her. We need Bay 1, he said, voice flat, controlled. Now, Marla was already stepping aside. We're ready, who's your physician contact? The corpsman did not answer that. He looked past Marla, past the residents, past the nurses, searching faces like he was matching them to a memory. Then he spoke again, louder, so the entire department could hear him over the rotor wash still vibrating in the walls. We need Nurse Ellis. The words hit the room like a dropped instrument. Not loud, not dramatic, just wrong in a way everyone could feel. Marla blinked. Excuse me? The corpsman's stare did not soften. Nurse Ellis by name. Where is she? A senior nurse laughed under her breath, one small sound of disbelief that died immediately when no one joined her. Ellis stood still near Bay 4's curtain. For half a second, she considered not moving. Let someone else step in. Let the hospital handle it. Let the attention pass. But the corpsman's gaze found her before she decided. His face changed, not surprise, not relief, recognition, like finding a tool you did not expect to see in the room but trusted anyway. There, he said, that's her. Every head turned. Ellis felt the weight of the room settle onto her scrubs, onto her badge, onto the quiet space she had been living inside. She kept her expression neutral, but her pulse tightened behind her ribs. Marla's voice sharpened. How do you know her? The corpsman ignored the question. Ma'am, we're out of time. He's unstable. He needs hands that know what they're doing. The attending doctor. Hargrove came out from behind the trauma doors, already pulling gloves on, eyes on the gurney. Who's the patient? Active duty, the corpsman said. Massive blood loss, penetrating trauma. We did what we could in flight. He's crashing again. Hargrove's eyes flicked to the monitor on the gurney and hardened. Pressure's dropping. Move him. The gurney rolled toward Bay 1 and the ER shifted around it like water around a rock. Nurses cleared paths. Residents grabbed equipment. Someone ran for blood. Ellis moved without being told. Not rushing, not hesitating. She stepped in beside the gurney at the head, close enough to see the tube placement, the skin color, the fine tremor in the jaw that wasn't from pain but from a body losing its fight to compensate. Hargrove noticed her and frowned. Who are you? Ellis did not look at him. Her eyes stayed on the patient's chest rise. Nurse Ellis. I didn't ask the corpsman cut in, calm but absolute. Doctor, she needs to be here. Hargrove's jaw tightened. This is my trauma bay. Ellis finally looked up, not challenging, not pleading, simply present. Tell me what you need. Hargrove stared at her for a beat, measuring whether this was nonsense or necessity. Then the patient's monitor screamed. A sharp, rising alarm, heart rate spiking. Oxygen falling, the kind of sound that ended debates. Hargrove snapped into action. Airway check, get me another line. We're going to transfuse now. Ellis's hands were already at the IV tubing, assessing flow, checking the site, feeling for infiltration without looking like she was doing anything special. She leaned closer to the corpsman, voice low. "What did you give him?" "2 units whole blood," he said. "Tranexamic acid, pressure support." "He's got an abdominal bleed we couldn't control." Ellis nodded once. Her eyes moved to the bandage at the neck, the soaked gauze, the way the blood tracked, not splashed, not smeared, controlled. Compressed, she did not say what she thought. Not yet. She simply reached for fresh gloves and pulled them on with a smoothness that did not belong to a new nurse trying to impress someone. Marlowe appeared at the bay entrance, face tight. "Ellis, what is this?" Ellis did not turn. "I'm working." Marlowe lowered her voice, but it carried anyway. "They asked for you." Ellis's tone stayed calm. "I heard." And Ellis's eyes remained on the patient, on the numbers, on the thin line between life and arrest. "And we keep him alive." Behind her, the ER watched, senior nurses, residents, techs, all of them trying to fit the moment into something that made sense. A new nurse did not get requested by a Navy helicopter. Not by name, not unless the hospital had been wrong about her from the start. Bay 1 tightened around the gurney as if the room had been built for this exact moment. Bright surgical lights, stainless steel trays, the sharp smell of iodine. The hum of the ventilator pushing air into lungs that no longer chose to breathe on their own. Dr. Hargrove stood at the head, hands steady, voice clipped. "Confirmed tube placement." "I want another large-bore IV, blood on pressure. Move." The corpsman handed off a folded sheet with flight vitals and interventions. He did not explain, he expected competence. Ellis slid in at the patient's right side without asking permission. Her eyes moved across details most people ignored because they looked like background. The adhesive edges of the neck dressing, the pattern of blood soak. The way the skin around the clavicle stayed too pale, even as the abdomen darkened with bruising. She placed 2 fingers on the patient's carotid pulse through the bandage for 1 controlled second. "Fast, thread-like. Pressure?" Hargrove asked. 80 systolic, Jenna answered at the monitor, voice tight. "Dropping. Hang the cooler now." A tech rolled the blood cooler in. Marlowe appeared at the bay entrance, posture rigid with authority that suddenly felt thinner than it had an hour ago. Her eyes locked on Ellis. "You are assigned to fast track." Ellis did not turn. "He is crashing. That is not your call." The corpsman spoke, calm but harder now. "Ma'am, with respect, it is. We do not ask for names unless it matters." Marla's mouth opened, then closed. The entire ER was listening. Hargrove cut through it. "Enough, everyone does their job. Ellis, if you're here, you're useful." "Don't make me regret it." Ellis nodded once, not in gratitude, but in acknowledgement of a boundary. She leaned in closer to the patient's neck dressing. The gauze was compressed tight, as if someone had attempted field control of bleeding. But the blood was still seeping from beneath, slow and persistent. Not arterial spray, not a clean seal. Her eyes flicked to the left shoulder, an irregular bandage pattern, too carefully placed, hiding something under it. Ellis did not lift it, not yet. "Doctor," Ellis said quietly. Hargrove did not look at her. "Speak. The neck dressing is failing. If we pull it without a plan, we lose control of the bleed. I want suction ready and 2 clamps within reach." A resident glanced over, amused at the idea of a nurse directing and attending. Hargrove's eyes finally met Ellis's, a brief stare, calculation. Then he nodded. "Do it," he said, "but you own it." Ellis reached for suction tubing and positioned it herself. She did it like someone who had done it in places that did not have bright lights or extra hands. "Clamp," she said softly to a tech without turning her head. The clamp appeared in her palm immediately. Ellis lifted the edge of the dressing just enough to see. A jagged laceration above the clavicle, deep. Dangerous placement, near vessels that did not forgive mistakes, not an accident. She covered it again without exposing the room to the sight. "We need vascular," she said. Hargrove's jaw tightened. "We are vascular until vascular arrives." Ellis did not argue. She simply shifted her body so her hands were between the wound and the air, keeping pressure steady while Jenna ran another set of vitals. 70 systolic, Jenna said. "Heart rate 140, Hargrove snapped. "Push blood, start pressors." Ellis looked at the IV flow and saw the first problem that was not clinical. The line was kinked, not by patient movement, not by accident. The tubing had been tucked behind the rail in a way that reduced flow without stopping it completely. A mistake that looked like fatigue. A mistake that could be explained. But Ellis had watched enough systems fail on purpose to recognize intent when it hid behind plausible error. She straightened the tubing and the flow improved immediately. No one noticed, except the resident near the pump who suddenly avoided her eyes. Ellis did not call him out. She did not create a scene in the middle of a bleed. She filed it away. Then she saw the second problem. The blood bank label on the cooler was correct. The seal was intact. But the inside inventory was wrong. The number of units did not match what had been logged on the screen. 2 units missing, not a delivery mistake, not with this urgency. Ellis shut the cooler quietly and looked to Marla at the door. "Who brought this?" she asked. Marla bristled. "Blood bank." Ellis's gaze did not move. "Which person?" Marla hesitated, a beat too long. "I do not know." Ellis nodded once. She did not blame Marla. She understood something Marla did not want to understand yet. Hospitals were built for accidents, not interference. "Lock the trauma bay doors," Ellis said. Marla stared. "What? Lock them," Ellis repeated calm. "No visitors, no consults unless they show ID and are on your board." Hargrove glanced over. "Marla, do it." Marla's face tightened, but she moved, because the attending had backed the instruction and because something about the Navy corpsman's presence had rewritten the power map. A unit secretary called out from the desk. "There's a man asking to come back, says he's family." Marla started to answer, but Ellis spoke first, voice low enough that only those close could hear. "Ask his name, ask for a code word from the admitting officer. If he gets angry, he is not family." The corpsman's eyes flicked to Ellis. Recognition again, this time sharper. Hargrove worked the airway and lines while Ellis held pressure at the neck, managed suction positioning, and quietly directed small movements that kept the room from tipping into panic. A tray closer. A light adjusted, a clamp placed before someone asked for it. Competence without announcement. Then a new figure appeared at the trauma bay entrance. A man in a suit, too clean for the ER, hair perfect, expression urgent in a way that felt rehearsed. "I'm with hospital administration," he said. "I need an update on the military patient." Marla stepped toward him automatically. Ellis's head turned slightly, not fast, just enough. "Show your badge," Ellis said. The man smiled, polite. "Of course, but no," Ellis said, still quiet. "Now." He reached inside his coat pocket. The motion was small, but it was wrong. Ellis shifted her stance without taking her hands off the wound, blocking the line of sight to the patient, putting her body between the bed and the doorway. She did it as if she was simply repositioning for pressure. The corpsman moved too, one step, subtle. His hand hovered near his belt, not dramatic but ready. The man's fingers emerged holding a plastic card, not an admin badge, no photo, no hospital logo. Ellis did not need to see more. She spoke to Marla without looking away from him. "Call security to Bay 1, she said, quietly, and tell them not to come alone." The man's smile thinned. His eyes assessed the room, then he took one slow step back. "Misunderstanding," he said softly, and disappeared into the corridor before anyone could stop him. For a moment the ER did not breathe. Hargrove looked at Ellis, voice lower now. "What was that?" Ellis kept pressure on the neck wound, eyes on the monitor. "Not family," she said. Jenna swallowed. "Is someone trying to get to him?" Ellis did not answer directly. She chose restraint because panic would kill faster than any intruder. She spoke only what mattered. "Keep working," she said. "And do not let anyone you do not know touch his lines." Outside, the rotor wash had faded. Inside, something more dangerous had taken its place. A quiet, deliberate pressure, like the ER had become a room inside someone else's plan. And Ellis, without raising her voice, began to take that plan apart. Security arrived without sirens, but the change was visible the moment they stepped into the trauma corridor. 2 officers, hands near their belts. Eyes working the hallway the way nurses worked a crashing patient. Fast, quiet, systematic. Marla met them outside Bay 1 and spoke in a low voice, trying to keep control of her own department. Ellis did not listen to the words. She watched the officer on the left. His gaze went to the door, then to the ceiling camera, then to the nurse's station. He was looking for the story behind the story. Inside Bay 1, the patient's blood pressure rose a few points and then slid again, as if the body was negotiating and losing. 68 systolic, Jenna said. Hargrove's jaw tightened. "We cannot keep pouring blood into a leak we are not controlling." Ellis kept pressure on the neck wound, hands steady. Her gloves were wet now, but her voice remained level. "Give me 30 seconds," she said. Hargrove looked at her, then at the monitor. 30. Ellis did not peel the dressing off like a reveal. She lifted it in a controlled way, one corner at a time, while suction stayed in position and clamps waited within reach. The wound was worse than the gauze had suggested. A deep cut above the clavicle, bleeding in a stubborn sheet that did not pulse but did not stop either. Not a clean laceration from a fall. A deliberate injury, placed where it would bleed without being obvious until it was too late. Ellis adjusted her hand position and changed the angle of pressure upward and inward, compressing the space where the vessel ran close to bone. The bleeding slowed. Hargrove noticed immediately. His eyes sharpened. "Do not move," Ellis did not. "This buys you time," she said. "But only if no one touches his lines." A tech stepped forward with a fresh unit of blood, and Ellis's eyes snapped, not to the blood, to the tubing. The tech's hands were gloved, but the motion was too quick at the clamp, too casual. Ellis covered it with a simple request. "Stop! Let me check the label." The tech froze. "It's fine." Ellis's gaze stayed polite and empty. "Let me check." She took the bag and read the label slowly, as if she were simply thorough. O negative, correct. But the spike port had a faint smear of moisture that did not match condensation, and the clamp on the line had been shifted. A small change, a dangerous one. Ellis set the bag down without connecting it. "Get me a new line," she said. The tech's face tightened. "We do not have time." Ellis looked up. "We have time if we do it right." Hargrove finally saw what Ellis had seen in pieces. The missing blood units, the kinked tubing, the false badge at the door, and now a line that did not feel safe. His voice dropped. "Marla, who is that tech?" Marla looked over, confused. "He's float pool." Ellis spoke quietly, without accusation. "Ask him to step out." The tech did not move. The room went still in a way that had nothing to do with medicine. Hargrove's tone sharpened. "Step out, now!" The tech's eyes flicked to the door. Then, without warning, he lunged. Not at Ellis, not at Hargrove. At the patient's IV pole, reaching for the infusion line like a man trying to finish a job before anyone could stop him. Ellis moved first, not with violence, with control. She hooked the IV tubing with her wrist and pulled it free of his grasp while her other hand drove a firm, precise shove into his sternum. Enough to break balance, not enough to break bones. The man stumbled backward into the supply cart. Metal clattered. A syringe skittered across the floor. Security was already at the doorway. They grabbed him, forced his hands behind his back, and pinned him against the wall. He did not shout. He did not plead. He simply stared at Ellis, expression empty, as if she was not a person but an obstacle. Marla stood frozen. What did he do?" Ellis did not answer Marla. She looked at Hargrove. "Keep working," she said. Hargrove swallowed whatever pride he still had and nodded. "Jenna, new line now. And no one touches anything unless Ellis or I confirm it." The bleeding stayed controlled under Ellis's pressure. The new unit went in clean. The patient's pressure climbed, slowly, reluctantly into the 70s, then the low 80s. The corpsman exhaled for the first time in minutes. "We can move him if we have a secure corridor," he said. A voice came over the radio at the trauma desk, short, official. "Flight crew is ready for immediate transfer. We have a military security detail inbound." Hargrove looked at Ellis. His expression had changed. Not admiration, not gratitude, something closer to fear mixed with respect. "You knew," he said quietly. "You knew this was coming." Ellis's eyes stayed on the patient. "I suspected." Marla stepped closer, voice shaking with anger and confusion. "Who are you?" Ellis finally looked at her. Her face was calm, but there was weight behind it now. "I am your nurse," she said. "Tonight that is enough." They transferred the patient under tight control. Curtains closed, corridor cleared, security at front and rear. Ellis walked beside the gurney until the ambulance bay doors opened and cold air hit her face. The helicopter blades were already turning again, impatient. As they loaded the patient, the corpsman leaned toward Ellis. His voice dropped so no one else could hear. "You were not supposed to be here," he said. Ellis met his eyes. "Neither was he." The corpsman nodded once, an acknowledgement that carried history without naming it. Then he stepped back and the crew lifted the gurney into the aircraft. Rotor wash filled the bay. Papers lifted off counters. The world became loud again. When the helicopter rose and disappeared into the night, the ER behind Ellis exhaled in broken pieces. Questions, whispers, anger trying to find somewhere to land. Ellis did not stay to receive any of it. She returned to Bay 4, pulled the curtain, and checked John Miller again as if nothing had happened. The monitor beeped steadily. His eyes watched her with the same careful calm. Ellis adjusted his oxygen cannula, checked his abdomen, and documented without looking up. Then she leaned close enough that only he could hear. "If you are here for him," she said softly, "you will not get another chance." The man's jaw tightened. He said nothing. Ellis stepped back, returned to the nurse's station, and resumed work. No speech, no announcement, no spotlight. Just a quiet nurse moving through a hospital that would never laugh as easily again.